Speaking of masks and things that are needed for healthcare workers, I did want to take some time to get to our next gentleman. Dr. Samir Sinha is Director of Geriatrics at the Mount Sinai Health System and University Health Network in Toronto. Good to see you, Doctor.
Thank you, Rosemary.
I saw your tweet, I don't know, one of the many times I woke up last night or when I woke up early this morning, and it did warm my heart a little bit, so I'll show people what you tweeted. You tweeted, "I stopped the car and wept last night. It was after midnight. I was driving home from another 18-hour day at Sinai Health, and then I saw this. Thank you to my city of Toronto and its citizens for these acts of love that are keeping frontline health workers going." So that's what you tweeted. It was after midnight, so I guess I was still awake. What did that mean to you to see that?
It was one of those things where, for all of us who are at the front lines, for me as a geriatrician, where I care for and I've dedicated my life caring for the population that COVID is absolutely brutal for. We're worried. We're worried about each other, our own healthcare colleagues. We're worried about our patients. We're worried about the country, and we haven't seen the worst of it yet. We know that in 2 to 3 weeks, our hospitals are going to be full. We're going to start seeing reports that you're seeing in New York and hopefully not Italy and Spain. And so there's a lot of anxiety, and amongst us, we're trying to continue our routine care and make sure that our regular patients are okay. And we don't want to make mistakes. So we have all of that wearing on us. And so it means that your usual days are twice as long. You're doing a lot more work and you're exhausted and you're tired. And just, again, right up the street are 5 major hospitals with many people like me. And so coming home at the end of a long day and just seeing like an act of love, it was just so lovely.
Well, I'm glad that could bring a smile to your face at a late hour after a long day. You are, as I said, Director of Geriatrics, and you're quite right. So many of the older people in this country are at risk for this. We see it, these breakouts in long-term care centers. It's very troubling. How difficult is it to be looking after, some of the most vulnerable at a time like this, knowing that you might not win all of those battles?
We've already lost a number of battles. Every single life that we lose is a potential life that, an infection that you hopefully could have prevented. So the population I'm most worried about right now is we know that the average population, the death rate is about 1% to 2%. So all Canadians in general. But when you start getting into your 60s, 70s, 80s, and 90s, that death rate climbs by 3, 8, 15, 24%. And for those who are living in nursing homes, it's about 1 in 3. So when the virus ripped through that home in Bobcaygeon recently, 60 residents, you do the math, 20 are now dead. It's a matter of math, and so the question is, could we have done more to prevent the virus from getting in the home? Can we do more to protect people in these situations for doing that? And so behind the scenes, and not only am I just caring for my regular patients and working with my colleagues to prepare our hospitals and our 8 sites for the care that we'll have to provide mostly to older people affected, but on the side, late at night, early in the day, I'm speaking to the ministers federally, provincially, making sure that we do everything we can to protect those seniors, the over 400,000 who are living in care homes across the country.
What about the idea, and I've heard some people talk about it, about just taking your parents or the older person in your life who might be in one of those centers out, if you can and if they can. What do you think of that notion?
Yeah, I mean, I struck a chord, I know, when Andre Picard in the Globe, wrote an article about this and said, Dr. Sinha, what would you do? And I said, I absolutely would if you could. Mm-hmm. But you know what, for families and individuals who choose to live in a long-term care setting, that's not a light decision. That's usually families who have become exhausted. They can't provide any more care. There's not enough home care available. The care difficulties are too much. And so that's why people have made that difficult choice to be there. And so it wasn't a glib comment, but it's a call to action to say, while we're very much concerned about our hospitals and making sure we have enough vents and all those things, are we doing enough, and can we do even better to protect the 400,000 people who, if all of them get COVID, that means over 100,000 will die. right? So this is the opportunity. So in Ontario, for example, I worked very closely with Minister Fullerton, our Minister of Long-Term Care, and we changed the regulations because there are families, for example, that the Prime Minister was talking about where people are unemployed. And they're saying, I couldn't work and also care for my mom with dementia. But I have families now who are saying, well, I'm unemployed. And you know what? I could actually care for mom, and I know what her needs are. They haven't evolved that much. And, if I can take her home. And so what we've done in Ontario, for example, is we said, if you can, and you're prepared for, and you think you can make this work, we'll allow you to take mom out of care during the pandemic, and then you can bring her back in when the pandemic is over, no penalties. And for those people who are at home now saying, you know what, if we got a call today and they say, can mom go in? But right now, we actually have the capacity and the time because we're at home together. If we can have a few more months to care for mom and then wait till the pandemic end, we've also said that if you make that choice to delay entry, you will not be penalized. And that actually improves the capacity in the system right now, so that, again, with hospitals overflowing, we actually have room.
I just have a couple minutes, Doctor, but what do you want Canadians to hear? Canadians who might not be getting it, Canadians who might be getting tired of it, what would you like them to hear from you?
Ladies and gentlemen, this is not a drill. I wept last night, and I'm working double hours right now because we know what's coming. This is all math. We know that not everybody's been doing the physical distancing that the Prime Minister and our health officials have been asking us to do. Some people are taking this lightly, and please don't, right? I'm working these long hours. All of my colleagues are working these long hours. We know we could die in caring for you. We know that this is not going to be easy. And you know what, right now, the hospital's quiet. We're actually not that busy, but we know 2 weeks from now, my colleagues, we're here and we're ready, but don't disappoint us. We all need to do our part. And please take this seriously.
Anything else that you need us to do to support all of you?
Just look after each other, and don't forget older people out there, especially who are scared, who are isolated, who, because of this physical distancing can't see their loved ones. So if you have an older person in your neighborhood, look out for them. My friends have been great because they know I'm not eating much these days. So, what do I get? I now get a ready-made meal to make sure I eat. So look after your healthcare workers, look after each other. And if you've got a senior in your life, seriously, reach out, don't touch them, but reach out and look out for them too.
Doctor, it's so good of you to make the time when you are working double shifts, you are doing such important work to keep us all healthy and safe and our loved ones healthy and safe. But I appreciate you speaking to people. I do think it makes a difference too. So thank you so much.
Thank you very much, Rosemary.
And thanks for all of your work. Stay healthy, stay safe.